the most fertile time during a woman's reproductive age is between the age of 25 to 35. That's the best time to conceive. But in case for whatever reasons you have not been able to complete family by the age of 35 and you have delayed the pregnancy, you must consider IVF, and the help is available. The advanced testing, everything is available under one roof. We have good specialists, embryologists, and all the equipment which is required to do an IVF, which is offered at any good place. So I'm Dr. Sarita Sukhija. I was practicing in India, Delhi and Gurgaon before I moved here for almost more than 15 years. And it's been almost more than 6 years that I'm practicing in Kenya. I am a gynecologist qualified from one of the good colleges of India, that is BJ Medical College, Ahmedabad. I did my graduation, post-graduation from there. And then I went on to do my master's in reproductive medicine and embryology from EV, Spain. And so I'm mainly into gynecology and IVF practice now in Kenya, and I work at this Myra IVF Centre, which was established about 4 years back. So gynecology is mainly a doctor who is dealing with the women's diseases. It includes the obstetrics is the delivery part, like pregnancies and deliveries, which I don't do much now. Only very special cases, high risk cases, if somebody requests, then I do. But gynecology is dealing with the women's diseases, which can be like pelvic infections and menopausal issues, the polycystic ovarian disease. So there are a lot of things which women suffer from: irregular cycles, fibroids, all those things. So that is gynecology. Now IVF is a very specialized field which deals with the IVF full form is in vitro fertilization, meaning people like couples who have been together for more than a year and they have been trying for pregnancy and they have not been able to conceive naturally on their own, then IVF and the fertility specialists like us have a role to play. We work on both the partners, the female as well as the male, to find out where is the issue, why they are not able to conceive. So that is a fertility part of the gynec, which is a super specialized field, you can say. So it deals with not only IVF but other forms of treatment which can help couple to have a baby. See, when a couple comes to us with the complaints that they are not able to have a child, then we work on both the males and female partner, and we try to do some test like the hormonal test for the female. The tube testing is done, and we also check whether she is ovulating regularly or not. We do an ultrasound to see the uterus is normal or not, if there is any problem with the uterus or tubes. And for the male, we check the sperm counts. If the sperm counts are low, then we give them some sperm boosting medication. So not every couple will need IVF. We can start with the basic things and we correct the hormonal imbalance, and we can give them some tablets first. We can monitor on the ultrasound when the egg is ready. So we tell them that now this is a good time to conceive. And before even we move on to IVF, there is something called IUI, which is intrauterine insemination. So I can explain you a little bit on this. You can see how the pregnancy forms. Normally a woman will have an egg in the ovary, and the egg is released. It comes inside the tube, and when they have intercourse, the sperms will move up and fertilize the egg. So that is how a normal pregnancy forms. So in IUI, what we do is we put the woman on injections, so that instead of one egg, she can have maybe 2 or 3 eggs. The eggs can be on both the sides, and when the egg is released, it goes into the, so we know that now the egg is here. So at that time we take the sperms of the semen of the husband, which is washed, and we go with a small catheter into the uterus, and the sperms are released here. You can see very close to the uterus, the tubes where the egg is, so that the sperm can go and meet the egg and pregnancy is formed. So this is the first form of treatment, which is not a very expensive treatment, and this is offered to women who are in younger age group, and if the tubes are okay and they are ovulating, the sperm counts are on the lower side, so those couples can go for this treatment, which is a cheaper option, because here we are actually assisting the natural conception to happen. We are just assisting the egg and sperm to meet and form a pregnancy. Now if we come to IVF, IVF is a little detailed procedure in which we have to get the egg and the sperm fertilized outside the body in the laboratory. So in IVF what we do is, a woman is given again injections from the beginning of cycle. The injections are given in little high dose because we want to have the eggs which are there in both the ovaries to come up, and it takes about 10 to 11 days for the eggs to be ready. And once the eggs are ready in the ovaries, then you can see through an ultrasound we go, this is an ultrasound probe, so with a needle we go inside the ovary and we take the eggs out. They are collected in the tube. So this is how the eggs look like, and then once the eggs are taken out, we collect the sperms separately from the husband, and so you can see ultrasound guided egg collection is done because we are putting in the needle through the vagina. So it is little painful process, like this. You can see we go from here up to the ovaries, and whatever eggs are there we take them out in the tube, and all the eggs are collected, and then the sperms are collected separately, and then you can see one egg is picked up, one sperm is picked up by the embryologist in the lab under a special instrument which is called ICSI, intracytoplasmic sperm injection. So in this, one sperm is picked up and it is injected into the egg, so they are fertilized in the laboratory. Like this, you can see this is how the ICSI and the sperm injection into the egg is done. So once the sperms are injected, then they are placed into the incubators to grow, and they grow, we can take them up to day 2, day 3 or day 5 depending on how many embryos we have. And then normally at our center and in most of the good centers nowadays, the fresh transfer is not done, meaning in one cycle we will take the eggs, we will make the embryos and we will freeze them, and we will let the woman have her cycle again, and then we start preparing her for the transfer. So the embryos which are made, they are frozen, and we transfer in the next cycle, because it is said that when we are giving hormones to a woman to make the eggs, the uterus lining might not be very good to catch the embryo, and that's why we do the frozen embryo transfer. See, the IVF process or the IUI process or anything for that matter, if we have to start any fertility treatment, it starts from the 2nd or 3rd day of the cycle, in the beginning of the cycle, and it takes about 10 to 11 days for the eggs to be ready. We monitor the eggs on the ultrasound, and usually on 13th or 14th day we take the eggs out. So you can say 2 weeks time is required when a woman starts her periods, and in the next month again 2 weeks time is required for the preparation, and in the 3rd week we do the transfer. Yeah. So a woman needs to be here for the IVF process 2 weeks, and the transfer process again 2 weeks. So in the next cycle, when a woman gets period, then we put her on tablets to prepare the uterus, and usually in the 3rd week you can see the embryos are taken out, and we usually transfer 2 or at the most 3 embryos depending upon the quality of the embryos, depending upon the age of the woman. So they are taken in a small catheter, and you can see the embryos are placed into the uterus. Like from here we go and the embryos are placed here. And it is not a painful process. The catheter is very soft and very small. So a woman comes in and we load the embryos, we transfer them into the uterus, and then she can go back after 1 or 2 hours of rest. And then once we put the embryos, usually in 2 weeks time, we can do the blood test and we can know whether the woman has got pregnant or not. And after the transfer, she needs to be on tablets and some injections which can support the pregnancy, and we advise 48 hours of rest, because that's the time when the embryo is implanting onto the uterus. So this is how the IVF works. And another important thing is, when suppose a woman is young and we have got say 8 or 10 embryos, so we at a time will transfer only 2 or 3, and the extra embryos which are there, we can keep them frozen for long time, for years together, so that in case they conceive during the first time, then they can come back after 1 or 2 years. They don't have to do the whole IVF process again. We can just take out the embryos and we can transfer them. So that's how the IVF works. Once a woman gets pregnant, the only thing is that when we put 2 embryos, sometimes if the embryos are very good, then instead of single pregnancy, they can have twin pregnancy. Both the embryos can implant, and so the chances of twins are about 20 to 30%. So those are the only pregnancies which need little special care, because in twins the uterus will grow very fast. They have incidence of preterm deliveries. Otherwise, once a woman gets pregnant, if it is a single pregnancy, then we say that first 3 months is the crucial time when the embryo is implanting onto the uterus. So that is the time when we put them on medication for supporting the pregnancy so that they don't miscarry. Otherwise, once she gets pregnant, it's like a normal pregnancy. They can, if everything is okay, the baby's position is fine, the pelvis is okay, they can even go for normal delivery, as long as the baby's heartbeat is okay during the time of labor. So there's nothing like the IVF pregnancy has some complications or it's a specialized pregnancy. Once the woman gets pregnant, it's like a normal pregnancy. If it is not a tubal factor, meaning the tubes were open and there was a problem with the uterus or the eggs or the sperms, so after, if the tubes are open and if she has got a child, one child with IVF, so it's not necessary that she has to undergo IVF again. If the tubes are open and she starts ovulating, then she can get pregnant naturally also. I have had patients who had an IVF and then after that 2 or 3 times they have conceived naturally. So it depends from people to people and the patients to patients. And but if the tubes are blocked and the sperm count is low, then those cases they will require IVF again, because if the tubes are blocked, then obviously it is very difficult. It is impossible for the egg and sperm to fertilize inside the body. So we tell them that if they have done IVF, they must keep their embryos frozen, so they don't have to go through the whole IVF again. We just transfer the embryos, the uterus is prepared, they have one baby, and after 2 years they come back. We take out the embryos which are frozen and they are transferred. So that's an easy thing, that's not difficult. See, IVF is something which is, we are fertilizing the egg. We make sure that the egg is fertilized, which is not happening in the body sometimes. And the fertilized embryo, it's sort of a baby. In scientific term we call it embryo, which is placed into the uterus. And I also get a lot of patients who have failed IVF cycles outside, and in such patients we do offer the genetic testing, because it is also not offered at many places. In genetic testing, basically, once we have the embryos, you can see the embryo. So we take out a small tissue from the embryo. It is called embryo biopsy, and it is sent for testing. Again, the testing lab is not here, so we send to either Egypt or UK. and the embryos are sent for testing, and we wait for the result, and we'll get the result that this embryo is normal, this is normal, this is abnormal. So the abnormal embryos are the ones which result in failure. So if we pick up a normal embryo, and we also check the uterus with the hysteroscopy, and we inject the PRP into the uterus to help implantation, then a lot of women who have had failed IVFs also are able to conceive. It comes at an extra cost, but it is one of the modality by which we have been able to give the positive results to the woman. So in this biopsy, not only we get the report that the embryos are normal or abnormal, we also, because here it's allowed, it's you can even know the gender of the embryo, it's a boy or a girl. Sometimes someone has 3 girls, they want a boy, so then we can pick up the embryo which is normal and boy, and that can be transferred. So all these facilities, the facilities which are available in the most developed countries like US and UK, we have everything here in Kenya, and we want people to avail the facilities, and which can help them complete their families and give them happiness to the couples who are struggling. And also we also feel happy that we have been able to help someone struggling with infertility. Once a woman is pregnant, whether it's IVF or a natural pregnancy, nobody can make out outside whether it, unless they go and tell the doctor that it was an IVF pregnancy, or they tell the friends or anyone. It's like a natural pregnancy. The only thing is, as I told you, just the first 3 months a woman has to take little extra care so that she doesn't miscarry, and we put them on some tablets and injections to make sure that they don't miscarry. Otherwise, once the pregnancy implants and the baby is growing, at the end of 9 months, if everything is okay, it's not necessary that they have to undergo a cesarean, because it's a very precious baby. It is a precious baby. Every baby is precious, but if everything is normal, it's like they can even try a normal pregnancy, the natural labor. We try to find out what is the reason why a woman is not able to conceive. So there could be problem in the uterus, like if a woman has fibroids and they are occupying the place where the baby has to grow. So on ultrasound we can look into all these things, and if there are fibroids, we need to remove them. And then we also look at the tubal factor. So in case the tubes are blocked, which can be found out by the tube testing, and if the tubes are blocked, obviously the egg cannot go inside the tube where the fertilization takes place. Those are the women who will need IVF. And then the women who have like other issues like polycystic ovarian disease, which is quite common in the young girls. So they are not able to make egg on their own, and even if they make egg, because of the hormonal imbalance, the egg quality is not very good. So PCOS women, then women who have endometriosis, again the egg quality is compromised. Then when the women are sexually active, then there can be pelvic infection, which can lead to the blockage of tubes. So these are the factors in a woman. If they are not able to conceive and we find that there is some issue which is preventing her to get pregnant, then we offer them the IVF. And similarly for males, there has to be an adequate number of sperms which can reach the egg to fertilize in the tubes. If the sperm count is low, or if the sperms which are moving, the motile sperms, they are less, then they will also need IVF. The age of a woman is the most important factor in terms of successful natural pregnancy or even IVF pregnancy, because as a woman will age, say after the age of 35, the egg quality starts deteriorating and the number of eggs also starts going down, because every woman is born with certain set of eggs, and it is said that a woman in her reproductive age group will ovulate about 400 times in her whole reproductive lifespan. And if a woman is getting older, like nowadays we see the girls are postponing pregnancy because of the career or work or any other issues. So we say that if a woman hasn't got pregnant by the age of 35, then she must go and freeze her eggs. So this option is available if a woman hasn't found the right partner by the age of 33, 34. They should come and we can, it is the same process. We give them injections, we take out the eggs and we freeze the eggs. And they can come by the age of 40 or 42 whenever they are ready to have a child. Then the eggs which were frozen at a younger age, they have a better pregnancy chance than trying the pregnancy after the age of 40. So we have to be very careful if a woman has postponed pregnancy and they have been trying and they have not conceived by the age of 37, 38. If they come and if everything is okay, we do give them a trial for IUI for maybe 1 or 2 cycles, but we should not waste too much time, because as the woman will get older, it is going to get difficult for them to be pregnant. So as I told you, it's like an IVF process. A girl will come on the 2nd day of the cycle and we will put them on injections, because when a girl is young, so say there are 5 eggs here, 5 eggs here, so we want all those 10 eggs to be taken out and frozen, because it is said that if we are even freezing the eggs, to have one successful pregnancy there should be at least 8 to 10 good eggs. So when the girl comes, we put her on hormone injections and we do the ultrasound, and in 2 weeks time again the eggs are ready, and we go through the vagina again like the IVF process. We take the eggs out. So because she doesn't have a partner, she wants to freeze her eggs, so we are not fertilizing the eggs at that time. We are just taking out the eggs and we are freezing the eggs, and those eggs can be frozen. They can be kept frozen for many years till she is ready to have a baby. When she gets married to somebody or she has found a partner and she is ready to have a child, then we ask the partner to come and give the sperm, and then we take out those eggs and they are fertilized, and then the embryo is placed like in a normal IVF cycle. Yeah. And it's very safe procedure, and it like even the egg collection is done under short anesthesia, so a woman doesn't feel any pain. And sometimes if the number of eggs are not enough, like say there are only 4 or 5 eggs, even at the age of, sometimes it can happen, and her AMH is the test, anti-Mullerian hormone, which is the marker of fertility. So we say that all the women who have reached by the age of 33, 34, they should just walk into any lab. Even we also have that available. Just get your AMH done, and if it is lower than 1, then you should hurry up and go and freeze your eggs. So the normal levels are between 1 and 4, and anytime you feel that it is going down, the number of eggs are going down. If the number of eggs are less, then they might need 2 rounds of stimulation. Say in one cycle we have got say 5-6 eggs. Once they get the period, then we do the same process again, and then again we collect another 6 eggs. So it depends upon how many eggs are there, and we prefer having at least 12 to 15 eggs to be frozen if they want to have at least 2 or 3 healthy babies later on. I've had a lot of girls who come to me and they say they are in the age group of 34, 35, and they say that we are not yet ready to have a baby. Then or they have some issues in the marriage, they are not ready to have a child for whatever reasons. So those are the girls, we tell them that please come and freeze your eggs, and you can use them later whenever you are ready, because if they are frozen at a younger age, the chances of getting pregnant even in the later age group are very good. But if they postpone pregnancy and if they have not frozen the eggs and they come to me by the age of 40, and at that time the quality of the eggs and the number of eggs are going to be very, very low, and the chances of pregnancy by the age of 40 are only 10 to 15%, not more. Whereas less than 35, the chances of pregnancy are still 50 to 60%. And that is why whenever the girls come and they ask for it, we offer them this. And I've had many girls who have frozen their eggs by the age of 33, 34, and after 3-4 years when they found the partner, they came and they had successful pregnancy. Some of the women, like I would say the educated women mostly, who have not been able to get pregnant, they are quite open about it and they do come with their partners. And those who have, but still, whether you are educated, not educated, there is always a family pressure, like to have a baby in within 2 or 3 years of marriage, and if they don't have, obviously everybody starts asking. So they do come with the partners, and if they come alone, we tell them that please get your partner also, so that both can understand that it's not only the female who is responsible, but also the male, he can also have issues. In fact, 50% of the causes are because of the male issues. So we tell them to adopt a healthy lifestyle, like stop smoking, stop alcohol whenever they are trying for the baby, get all the tests done. And we also, because there are financial implications also, both have to prepare. So we explain them everything, and once we explain them and they are ready to accept this process, they begin it. But still, some of the women, usually, especially the Asian women, I would say, when they come with their in-laws, they say that please don't tell anyone that we have undergone IVF. We have told them that it's a natural pregnancy. So we don't, obviously it's a confidential thing. As long as they have got pregnant, we are happy for them. But there is still a taboo amongst a certain class, I would say, but not all. The educated women are quite receptive to this idea of having pregnancy through IVF. See, in IVF, as I told you, a lady has to be on injections first. So these are the hormone injections which are given in a little high dose. So there's a cost of injections, and then there is a cost of the lab process and the taking out the egg under anesthesia. So the injections itself cost between 120 to 130,000 Kenyan shillings. So at our center, we are offering the whole IVF as a package in around 550,000 Kenyan shillings, which includes the injections, the ultrasounds, because when a woman is put on injections, she will come here at least 3-4 times for the ultrasound to monitor the eggs. And then the egg pickup will be done under anesthesia, and then the fertilization happens in the lab, and then the embryos are frozen. So we don't charge anything for 2 months, because as I said, we do all the frozen transfers. So they come after a month and we do the transfer. So this cost involves everything, starting from the injections, the monitoring, the egg pickup, the transfer, and the freezing for 2 months. And it is because in the lab, there are a lot of things which are used to keep the embryos at the same pH and in the same environment that it should be in the body. So keeping the embryos outside the body for 3 to 5 days, we require a lot of things, and that is why it's little expensive. So there are few insurances which accept the IVF program. Like I have had 3-4 insurance people, like Max Bupa, Cigna, and Jubilee. They cover IVF, so we do have them on our panel, even APA. So if a patient has these insurances, they can always claim the insurance money. Even SHA has the IVF program, although because of whatever reasons, it has not been given to a lot of clinics yet, but SHA also covers IVF. Yeah, otherwise if the insurance doesn't pay, then obviously most of the insurances actually don't pay, except 3-4. So then the patients have to manage the finances on their own. The most fertile time during a woman's reproductive age is between the age of 25 to 35. That's the best time to conceive. But in case for whatever reasons you have not been able to complete family by the age of 35 and you have delayed the pregnancy, you must consider IVF, and the help is available. the advanced testing, everything is available under one roof. We have good specialists, embryologists, and all the equipment which is required to do an IVF, which is offered at any good place. So we are located at first floor, Myra IVF and Medical Center, first floor AB. This building is called the Westwood Office Building, which is just next to Sarita Center. And we are open from Monday to Saturday. And the phone number for making an appointment is 786-656-236. Even you can message me at 786-404972. You can write to me at drsarita2007@gmail.com, and we'll be happy to help you in any which way we can.